At the outset, accept my humble regards and a hearty namaskar. I welcome you aboard on my YouTube channel. I'll be sharing a journey from crisis to recovery. So in this series, I will be sharing few of my our patients in the last month, which have recovered miraculously. So the first patient I want to share a very special story from the ICU, a story of resilience, teamwork, and hope. A patient was received in emergency department at 10 p.m. in the night, few days back, with history of loss of consciousness 3 to 4 hours prior to admission. As the patient was an elderly patient, known hypertensive, loss of consciousness, so the call was sent to the neurologist. CT head and MRI head were done immediately in midnight. There was no bleed in the CT scan and no infarct in the MRI. But GCS of the patient, that is conscious level of the patient, remained low throughout the night. So when the patient was under continuous observation in ICU, few of the symptoms and signs were noticed. That the patient had pinpoint pupil, pulse rate was low, and there were excessive secretions in the chest. And there was no movement of the body. So the clinical diagnosis of organophosphorus poisoning was made. Family members were called, but they were not ready to believe and agree to this diagnosis of poisoning because they were not aware of any history. Well, they were counseled that is the way ahead and treatment needs to be initiated. Finally, they agreed. So the patient was taken on elective intubation with ventilation, and the antidotes for the organophosphorus poisoning, atropine and pralidoxim, were started, and patient was on ventilator. Vitals were maintained, and then gradually on the third day, we attempted weaning, and by the fourth and slowly by the fifth day, patient became conscious. So this journey was not so simple as it appears when I speak about it, because there was a lot of resistance from the family members, so many phone calls from the distant relatives and known to doctors of the family who were suspecting the diagnosis. So it needs a good clinical experience to take these bold decisions. Now the family is very happy when the patient has been weaned off, extubated, made to walk, shifted to general ward, and now the patient has been discharged. So this is an interesting story of the journey of patient, not only for the public, it is more so important for the doctors, all doctor community, young doctors, because those doctors who have not seen organophosphorus poisoning in their practice, they will never be able to recognize such a case. Thank you.